Thank you very much indeed. One of the things that I know is very high on Director Frieden's list is antibiotic resistance and the fact that we're running out of effective antibiotics, and yet no new ones are appearing on the scene. I noticed that that is also one of the things that you commit to on there. Is this something that you've addressed in terms of how do we incentivize those who could develop new antibiotics to do so?
Yeah, so this is an outstanding question. And while we were developing and launching the agenda, the U.S. was also developing a new, our strategy, our national strategy on countering antibiotic resistance bacteria. And we have put forward an executive order on that, and also a national strategy on how we'll do that ourselves, and the ability to actually incentivize and work with the private sector on antibiotics. New antibiotics has been a huge part of that. Our Office of Science Technology Policy is leading that charge and has been working with the President's Council advisors on science and technology to work with the private community on ways to do that. I am not the expert for the White House on it, so I don't want to give you specific steps about what we have and haven't done since then, but I definitely, it's a huge area of focus, and we have been paying, we had a meeting on it yesterday, in fact, where this is one of the big issues that we're focused on achieving, and Dr. Frieden has been right there in the center of that as well.
And we've got some questions here. Clarion.
Might I make a small suggestion, since you've mentioned private at least once? And that is that you look at the countries you're in and find out what industries are in multiple countries. And that way you can get more bang for your buck, because someone can come to you and say, well, since you're in Finland and you're in Argentina and we have business there, there'd be much more interest. So you might want to assign somebody to look at that.
That's an excellent idea. Thank you.
Good morning. I'm Patrick Kelly from the Board on Global Health here at the IOM. I enjoyed very much hearing your presentation. I just had two questions for you. One is about sustainability. I was very involved with building emerging infection systems earlier in my career, and things were great as long as the U.S. government was pumping money into it. But the real challenge always is sustainability. And I was meeting with some folks at AID yesterday on the same thing. They're talking about the $6 billion funding that's potentially out there, and they wanted to be sure that what was built with it was sustainable. So I wondered what your strategy is for that. And then with regard to political will, if you could elaborate a little bit more on the role of non-politicians in establishing political will. I know the politicians in some of the most vulnerable countries have many agendas they're juggling. And are there other voices, like the corporate voices, that can help ensure that this gets the priority it deserves?
Thank you for asking that, Patrick, and I think that is a terribly important one. I think we saw very clearly during the AIDS, the worst days of the AIDS crisis, that political will was terribly important in getting it onto people's agendas and radar screens. And I think all of us, and the corporate sector can play a big part in raising political will, but I think all of us can do that. So.
No, I fully agree with that, and I think that in fact one of the things that I know that Finland as chair, one of the reasons they asked to meet with a broad swath of the non-governmental community when they were here last week is because they and we really believe that one of the keys to success is going to be having strong partnerships within specific countries to fill gaps that don't depend on just the government to government interactions. So I think you're right. I think one of the challenges that we've had is looking at all of the successes, which you've been hugely part of yourself here at the Academies, all of the successes that we've had in building politically based partnerships and translating that to actually being able to meet the core capacities that are required. And it's very challenging to take sort of projects that are time limited, that build specific capacities, but then be able to build what's the will that's necessary and get the extra funding required to actually meet a target. And that's going to be the biggest challenge I think that we face going forward. But I think that we have enough momentum and enough examples of success that we can do this. I think it's going to take a very systematic approach in countries that really require a lot, including West Africa. So to get at your first question, we're working with AID on this and with other CDC in particular as well, to figure out how a lot of the capacity that's pouring into West Africa can be sustainable, and how we can look not only at the Ebola preparedness sort of checklist that's in place from WHO, but we're looking at how that translates into capacity for the long term, and we're encouraging other donors to look at that too. But it's an area where we're focusing literally right now, so it's very timely.
Okay, Ben Hoffman with General Electric. A functioning public health and medical system is essential for companies like ourselves to be able to work in these countries, and also obviously directly impacts and indirectly impacts the U.S. economy. You mentioned that there's an audit process that has been voluntary on parts of countries. Is there any reporting mechanism that checks these regulations, see if people are in compliance with these regulations? Because clearly they're not. And what can be done to have some type of dashboard or some sort of report card so that we know where the gaps are, and in public-private partnerships we can help in other ways these countries rise to a level that's considered a functional system.
So thank you so much for raising that. The IHR the International Health Regulations require countries to self-assess and self-report to the WHO. And so the actual data that comes out of the assessments is not published. WHO does put together aggregate data, and they have put together stakeholder meetings where countries that can provide assistance and countries that need assistance have come together on a regional basis to share information. But in my view, this is one of the major issues that we need to overcome, and in a way that doesn't name and shame so much as it helps countries transparently figure out what they need, so that donors can actually put forward the necessary dollars and capacity to actually build it. That's needed, and it's one of the things that we're very much hoping that the private sector and the non-governmental sector in general will help with. And it's one of the reasons we created the plug-in in the steering group for the non-governmental sector. So the pilot assessments we're putting forward will have external assessors from government. We'd really like to get input from the non-governmental community and from companies, private sector, on how this could be done in a way that doesn't put countries ill at ease that they're being graded, but at the same time allows them and the world to know where they stand. And I think that this can be done, but I think that we'll need a lot of good input from your community to do it right.
Follow-up question, did the high-impact countries with regards to Ebola self-report over the last couple of years?
Great question. So I have not actually looked at all of the data in aggregate form for each of the West African countries, but they are not capable of achieving the core capacities of the IHR. And did they participate in self-assessments? Most of them probably did.
Thanks very much, Elizabeth. That was a great presentation. I learned a lot. We have a really ambitious but meaningful vision, I think, that you've set out there that actually is quite inspiring. And I think just sitting in the margins of what's been going on, it is that call that we need. But we know that implementing and sustaining this is where the challenge is. And so that political will is really important. And Jack, as you talked about those early ugly days of the AIDS response, it's what really made the difference when you had that political leadership at the highest level. So that's the first step. The second step under that is you talk about a whole of government approach, and that's not easy, right? I mean, just in one government, a whole of government trying to work together, and we see it day in, day out, those challenges. and you sort of extrapolate that to the global governance sphere, and we look at those difficulties. But that's okay. We're here for difficult challenges. That's what we should be doing, and that's a challenge we've got to put forward. The fact that Ebola is only the second disease to be taken up by the Security Council clearly illustrates that this is not just a health challenge, this is a security challenge. So the message slowly gets through, I think. We need to push the international system. This is a great photo. We've got Margaret, we've got KG, we've got David Nabarro. I don't know if this is Ambassador Debbie Burke with her back to us, but... Secretary Burwell there. Yeah. So, but you've got, some of those architects at that level, but what's driving them and what are their incentives? So we've got to be pushing the international system at each meeting to be more coherent. So we've got to be more coherent. So the messages we give to WHO need to be matched with the messages we give to, the other organizations that are really, and often we don't do that. We give very contradictory messages, so I think we have to challenge that. My hope is as we take through the negotiations in 2015 now for the post-2015 development agenda, we can have something explicit in the targets around here. At the moment, this is all captured in one quite amorphous target under a health goal, so I hope we can be a little more explicit there. My final point is Jack, on microbial resistance, and it might be good for this forum to consider in terms of how do we create the incentives for improving access to medicines writ large. At the moment we have real challenges of getting access, and what about the ways of creating the right incentives for discovery and R&D. And so we've written UNAIDS with UNDP and the Office of the High Commissioner for Human Rights to the Secretary General twice now to say we're asking him to set up a panel to consider alternative ways of creating the right incentives for global challenges. Because global challenges in terms of access, and discovery. And again, I think this might be something, because this is so much public and private coming together, it might be something for this forum to take forward. Thanks.
Thank you very much, Simon, for bringing that up. And I really do encourage us in the forum to take that particular one up. Whenever I see, I think you wanted a question, Joe. Whenever I see a picture like that, I always feel reassured. I think that's great. All of these people are engaged in it. But then I realize that after they've finished their photo call and they go back to their offices, they've got other things that they're on their plate and that they're going to be thinking about. And that it's just always really important to make it sustainable and to keep the political will going. Joe?
I think two comments. Again, I'm glad Simon raised the issue of antibiotic resistance, which has been a topic that has come up here. I'm reflecting on another connection perhaps this forum and the IOM could make with academies of science and medicine in the target countries, because I think in many instances they represent the scholars and have the credibility and the convening authority you may need going forward. And we just came off of a meeting in Africa, and I noticed Kenya is up there, and Uganda, Nigeria, I think as well, all of which have very active academies. But the other thing I wanted to reflect on is the Finns are really the world champions of capacity building driven development, and they've been thought leaders globally in health and all governance policies. And so you've got a real winner there, and I think it's really important to let them take leadership, because they are well regarded in the international community for both things that you want to see come out of this. We sadly are not quite, we tend to be a little bit more short term in what we do, but I think the partnership, but the Finnish leadership is very exciting because everybody knows who they are and what they're about, and so I would really push them out front.
Because they have done it not only globally, but in their own country, and have a 50-year history of making an enormous difference to their own public health. Sir George.
Thanks very much. This was absolutely beautiful presentation, really impacting, and I applaud the work that's being done. But whenever I hear presentations like this, I always remember a gentleman called Samuel Adams. I remember the name because the name of a bear. 104 years ago, wrote in the first issue of the American Journal of Public Health and public hysteria, how public hysteria drives public health. When you look at what is happening in terms of Ebola, et cetera, and look at it in terms of what Amartya Sen and Lincoln Chen spoke in terms of what is really health security, there are other issues that we need to consider with just as much seriousness. And I hope when we speak of the work of the Forum in public health, public-private partnerships, we achieve some kind of balance between attending to the hysteria of public health and attending to some of the other problems that have much, much, much greater magnitude. As Sen and Chen pointed out, the issue of nutrition, for example, is a much greater problem in terms of health security. And I like Simon's point he's making about antimicrobial resistance, which you know a bit about. It is true, and I would urge, when we speak about this, remember Joshua Lederberg's really last great article. It is true that antimicrobial resistance is a mega problem, no doubt about it. But more people die for lack of access to antibiotics than die of antimicrobial resistance. So we need some kind of balance about antimicrobial resistance, but at the same time, put in place those partnerships to allow access of people who need antibiotics to get them, and to stop the inappropriate use of antibiotics as being other two major strategies. So in terms of the work of the forum, I hope we do remember have some balance between the knee-jerk reaction to hysteria and identifying some of the mega global problems that do exist.